Top stories tonight in Y News. The Philippines is back to moderate risk classification for COVID-19 cases as more Delta variant cases are detected in the country.
Metro Manila mayors are willing to place the National Capital Region under enhanced community quarantine amid the rising number of Delta variant cases.
Residents in provinces placed under enhanced community quarantine to receive cash aid from the government. PNP Chief Guillermo Eleazar relieves the Quezon City Police Station 3 commander for deploying PNP personnel for SONA duties while awaiting their COVID-19 test result.
The National Bureau of Investigation will conduct a separate probe into the killings of two activists in Albay who were shot dead by policemen last Monday. And know how to overcome your fear of needles in order to get vaccinated against COVID-19.
Good evening, Philippines and the world. We are now reporting live from Commonwealth, Quezon City, and today is Thursday, July 29, 2021. I am William Theo.
Join us in the next hour as we deliver today's top stories around the country and in other parts of the world. I'm Angelo Castro III.
We are also seen in 1,935 satellite monitoring centers nationwide and via live streaming worldwide through the UNTV News and Rescue social media accounts and our website, untvweb.com. I am Herlene Delgado.
First in the news, COVID-19 cases continue to swell in the past 2 weeks, prompting government health authorities to place the Philippines back to moderate risk classification. This is nearly a month after the country was tagged as low risk from the coronavirus. Meanwhile, the Department of Health detects 97 more cases of the more contagious Delta variant. Our health correspondent Aiko Miguel has the details.
The Department of Health has observed the prominent rise of COVID-19 cases in the Philippines within 2 weeks. That is why the country is back to moderate risk classification due to the increase of newly recorded infections.
National cases saw an increase in the recent week. This is an increase of 453 cases per day compared to the previous week's 5,576 cases. That is July 15 to July 21. Our average daily attack rate is still at moderate risk.
According to the Department of Health, from July 22 to 28, there were 6,029 average daily cases recorded in the country. That number is over 400 cases higher than the record in the past 2 weeks. The DOH says with a fast rise of cases in the National Capital Region, it is possible the Delta variant is one of the causes. 11 cities in the NCR are also seen with a 2-week growth rate. 3 cities in the NCR are now at high risk.
Makati and Las Piñas and Pasay are the cities currently with a high-risk average daily attack rate. The whole region is now again at a positive 2-week growth rate at 19%. This should be a cause for concern as NCR has been at a negative 2-week growth rate for weeks before this current week.
Aside from the NCR, top regions seen with high new cases yesterday are Calabarzon, Western Visayas, Ilocos Region, Central Luzon, and Central Visayas. Based on the DOH report this afternoon, there are 329 new variant cases recorded in the country. 83 are Alpha variant, 127 are Beta variant, 22 are P.3 variant alert for further monitoring. 97 are new Delta variant cases, 88 of which are local cases. Currently, there are now 216 Delta cases in the Philippines. 8 of those patients succumbed to the more transmissible variant. As local Delta cases continue to rise, the public is advised to be extra cautious and strictly follow the health protocols. Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
The Philippines recorded 5,735 more COVID-19 cases, pushing the total number of those who contracted the viral illness to 1,572,287. Active cases, or those still undergoing treatment, are at 56,273, the DOH said in its latest case bulletin. Of the active cases, 93.5% were suffering from mild symptoms, 1.2% were asymptomatic, 1.61% were in moderate condition, 2.3% were severe, while 1.4% were in critical condition. The DOH also noted 176 more fatalities, raising the country's COVID-19 death toll to 27,577. The recovery count also jumped to 1,488,437 with 4,069 new recoveries. The Octa Research Group warns of a longer lockdown if the government waits for COVID-19 cases to further surge before implementing stricter restrictions. Meanwhile, a former advisor to the National Task Force Against COVID-19 believes that Metro Manila must be placed under a community quarantine classification stricter than GCQ. Ray Pelayo will tell us why.
Former Special Advisor to the IATF Dr. Tony Leachon is alarmed over the decision of the government to implement GCQ with heightened restriction in Metro Manila. This despite the increasing number of COVID-19 Delta variant cases in the region. Leachon supports the recommendation of implementing stricter restrictions such as ECQ or MECQ. He noted that the Philippines should learn from the experience of other countries that experienced a surge of COVID-19 cases.
Nakakatakot yun kasi no other Asian country like Indonesia or India na control ang pandemya nila with a hard lockdown. Ayaw natin ngayon kasi ayaw na natin magkaroon ng ganong klase. So, I was expecting a higher quarantine.
Leachon said that the government should improve its programs for testing, contact tracing, and vaccination. The Octa Research Group respects the decision of the government but insists that strict restrictions should be in place. They explained that the higher the case, the longer days of lockdown is required.
Last year, noong August na nagka-surge, we were at less than 2,000 cases sa NCR. Yung lockdown natin 2 weeks lang. Pero nung March, nag-lockdown tayo at 4,000 plus cases. Umabot ng 5 weeks yung lockdown. So, the higher the caseload, mas matagal yung lockdown natin.
The group suggests to implement strict border restrictions, longer curfew hours, banning of social gathering, and reducing capacity of establishments. Vaccinated individuals can be allowed to go out but fast-track the interval of vaccination. Ray Pelayo, UNTV News and Rescue. We serve the people. We give glory to God.
The Metro Manila mayors appealed to the task force against COVID-19 to place Metro Manila under enhanced community quarantine, but they asked from the national government for cash assistance should ECQ be implemented. Asher Cadaban Jr. explains why live. Yes, Asher.
Arlene, the Metro Manila Council are concerned about the welfare of affected citizens as the country strives from crisis brought about by the pandemic. This as the Metro Manila mayors all agreed to recommend the implementation of stricter community quarantine restrictions in the National Capital Region in the first half of the month of August. This is due to the increasing COVID-19 cases and the threat of the spread of the more dangerous Delta variant. Last night, President Rodrigo Duterte announced the NCR will remain under the general community quarantine with heightened restrictions from the 1st to the 15th of August. But Metropolitan Manila Development Authority Chairman Benhar Abalos Jr. explains that the local chief executives are willing to place the NCR under enhanced community quarantine. However, the national government should also provide financial assistance to concerned sectors if they have sufficient fund for it.
Alam naman natin maraming gastusin ng national government ngayon because we could not do an ECQ without an ayuda or financial assistance, especially to our poor brethren. No? Siyempre, mahirap. 2 linggo wala kang trabaho. We must also consider that.
The Metro Manila Council are scheduled to meet with the Interagency Task Force for the Management of Emerging Infectious Diseases as the NCR mayors appeal for the said implementation. But should the IATF says otherwise, the Metro Manila mayors recommend to allow more restrictions on top of what is currently being implemented.
Let's review the capacity Kung kinakailangan wala munang dine-in dahil alam mo, this is very contagious, this is very aggressive, this is very infectious. Puro take out kamukha nung araw, no? These kind of things. Let's restrict mobility, no? Let's yung high GCQ with heightened restrictions, lagyan mo pa ng restrictions.
Arlene, the MMC, however, advises the public to not panic in any quarantine restriction that may be imposed in the coming days. Arlene?
Thank you, Asher Kadapan Jr. reporting live.
The government is still uncertain if there are still available funds for the local amelioration once the National Capital Region is placed again under enhanced community quarantine. The Metro Manila Council proposed a 2-week hard lockdown in the region as preemptive measure against a more transmissible Delta variant. Rosa Licos explains why.
The government had allotted 22.9 billion pesos to provide 1,000 pesos worth of cash assistance to 22.9 million low-income individuals in the Greater Manila area when enhanced community quarantine was reimposed in April due to COVID-19 surge. The palace admitted the government is still uncertain where to get the funds needed if NCR is placed again under hard lockdown.
Pag tayo nag-lockdown sa Metro Manila, napakadaming magugutom at siyempre po 60% po ng ating GDP ay galing sa Metro Manila at yung mga plus 8 areas. So complete closure of the economy, mawawalan ng trabaho, and ang katotohanan po, hindi ko po alam kung meron tayong pang-ayuda para sa another malawakang lockdown.
The proposal of the Metro Manila Council to place the capital under hard lockdown for 2 weeks as long as there would be cash assistance was not discussed during the Interagency Task Force meeting with President Rodrigo Duterte last night. It was when a new round of community quarantine in the country has been approved. Today, the IATF and Metro Manila did set a meeting to discuss the issue, but Palace reiterated aside from the regular criteria, the government is considering the total health in imposing community quarantine restrictions.
Ang desisyon na nakakaapekto sa COVID, hindi lang po sa larangan ng pagkakasakit. Kinakailangan tignan din po natin yung ibang aspeto ng buhay ng ating mga mamamayan. Kung ikagugutom pa po nila yan, kung kaya ba natin silang bigyan ng ayuda para hindi sila magutom.
According to government experts, though the number of COVID-19 cases in NCR increased, the healthcare and intensive care utilization rates in the capital are at low-risk level. Malacañang has assured the Duterte administration is closely monitoring the COVID-19 situation in the country, and if there's really a need to implement stricter quarantine classification in NCR, the government will find ways to provide assistance to those who will lose their jobs. Rosa Licos, UNTV News and Rescue. We serve the people, we give glory to God.
Meanwhile, families and provinces placed under enhanced community quarantine will receive cash assistance from the government. Nel Maribuhok reports.
Bayan Muna Party List Representative Carlos Zarate questions the government's COVID-19 response in provinces experiencing a surge of cases. According to the lawmaker, the government should also provide financial assistance to provinces placed under strict quarantine measures. Starting August 1 to 7, Iloilo City, Iloilo Province, Cagayan de Oro City, and Gingoog City will be placed under enhanced community quarantine.
Ang tanong, may inilaan ba na ayuda ang ating pamahalaan? Bakit kung magkaroon ng ECQ dito sa National Capital Region, naglalaan ng ayuda? Bakit sa mga rehiyon ay walang ayudang inilaan ang pambansang pamahalaan?
Zarate adds the government should not await for the passage of the 2022 national budget.
Na alam naman po natin na yung gaan na yan, kung maipasama ng Kongreso at malagdaang batas, ay sa susunod pa na taon.
The palace assures that residents in areas placed under ECQ will receive cash aid from the government.
Inapruban po ng Presidente ang pagbigay ng 1,000 tulong sa mga nangangailangang mga kababayan natin sa mga areas na nasa ilalim ng ECQ, at ito po ay hanggang maximum na 4 po kada pamilya.
The Department of Social Welfare and Development will distribute the cash aid through its Assistance to Individuals in Crisis Situation program. Meanwhile, House Deputy Speaker Mikey Romero believes that the passage of the proposed Bayanihan 3 would still proceed.
Ang napag-agrihan yata dito between the Senate, the lower house, the House of Representatives, and yung grupo ng economic managers is to consolidate it much more to about, if I'm not mistaken, about 140 to 170 billion. Parang ililiit kasi hindi nga makahanap ng budget. Pero so far, nakahanap na daw ng budget. I think magpo-proceed to.
The House has approved the 401 billion peso COVID-19 stimulus package. Under the Bayanihan 3, there is an allocation of 216 billion pesos for financial aid to lockdown-affected residents. Nel Maribuhok, UNTV News and Rescue. We serve the people, we give glory to God.
For those watching our 24/7 live streaming on YouTube, please click the subscribe button you see on your screen and ring the bell for notification. You may also follow us on Facebook. President Rodrigo Duterte has approved the extension of General Community Quarantine or GCQ with heightened restrictions in the National Capital Region or NCR until August 15, 2021. The approval was based on the recommendations of the Interagency Task Force or IATF given the current COVID-19 situation in the country. Rosalie Cruz explains why.
Apart from Metro Manila, 4 of its nearby provinces, Bulacan, Cavite, Laguna, and Rizal, will also be placed under GCQ with heightened restrictions from August 1 to 15. Other areas that will be under GCQ with heightened restrictions beginning August 1 include Ilocos Sur, Cagayan, Lucena City, Naga City, Aklan, Bacolod City, Capiz, Negros Oriental, Zamboanga del Sur, Misamis Oriental, Davao City, Davao del Norte, Davao de Oro, Davao Occidental, and Butuan City. Meanwhile, the province of Iloilo and Iloilo City will remain under Enhanced Community Quarantine or ECQ until August 7. The ECQ status will also be retained in Cagayan de Oro and the city of Hingoog in Misamis Oriental. The modified ECQ or MECQ will be imposed in Ilocos Norte, Bataan, Lapu-Lapu City, and Mandaue from August 1 to 15. GCQ classification sans restrictions will be implemented in Baguio City, Apayao, City of Santiago Isabela, Nueva Vizcaya, Quirino, Quezon, Batangas, Puerto Princesa, Guimaras, Negros Occidental, Zamboanga Sibugay, City of Zamboanga, Zamboanga del Norte, Davao Oriental, and Davao del Sur from August 1 to 31. General Santos City, Sultan Kudarat, Sarangani, North Cotabato, South Cotabato, Agusan del Norte, Surigao del Norte, Agusan del Sur, Dinagat Island, Surigao del Sur, and Cotabato City in the Bangsamoro Autonomous Region in Muslim Mindanao will also be placed under regular GCQ for the entire month of August. The rest of the country will stay under MGCQ next month. Rosa Licoz, UNTV News and Rescue. We serve the people, we give glory to God.
A station commander of the Quezon City Police District has been relieved from her post after several cops deployed during President Rodrigo Duterte's SONA were tested positive for COVID-19. Leah Ilagan explains why.
There was a clear breach of protocol. This is how Quezon City Mayor Joy Belmonte described the deployment of COVID-19 positive cops during SONA Day. The cops were tested on July 23, while their test results were released after the SONA on July 27 and 28. Belmonte says such action are punishable by law.
That is punishable under RA 11332. And however, the city government, we do not have disciplinary jurisdiction over the Quezon City Police District. That's why I believe that Chief PNP Guillermo Eleazar should address being their superior.
PNP Chief Police General Guillermo Eleazar confirmed that Quezon City Station 3 Commander Lieutenant Colonel Christine Tabdi has been relieved from her post. The administrative relief was for command responsibility.
Iniimbisigahan na natin ang maaaring paglabag sa pinaputupad naming protocol sa mga PNP personnel habang naghihintay ng resulta ng RT-PCR test.
Eleazar said they are now focusing on contact tracing and swab test for the close contact of the 82 infected QCPD cops.
Sa ngayon, nakatuon ang pansin ng PNP sa pagsagawa ng agresibong swab test at contact tracing upang matukoy, ma-isolate at agarang mabigyan ng medical attention ang mga kapulisan natin at ang kanilang mga close contact na posibleng nahawa ng COVID-19.
The PNP chief also appeals to public to avoid speculations over the incident.
Matagal na namin pinaghahandaan ang ganitong klaseng worst case scenario kaya makakaasa ang pamilya ng aming kasamahan na nahawa at ang taong bayan ng sapat at maayos na medical attention para sa kanila.
Earlier, QCPD Director Police Brigadier General Antonio Yara confirmed that from the 82 personnel of Station 3 tested positive from COVID-19, 51 of them were deployed during SONA Day as route security along Commonwealth Avenue and civil disturbance management team in UP Techno Hub. Leia Ilagan, UNTV, News and Rescue. We serve the people. We give glory to God.
The Department of Trade and Industry says the Philippines cannot afford to implement another strict lockdown amid the rising COVID-19 infections in the country. Marvin Calas reports why.
The Philippine economy will lose millions under re-implementing a tighter quarantine status in Metro Manila, including nearby provinces. Trade and Industry Secretary Ramon Lopez says this is the reason why the Interagency Task Force did not grant the recommendation of Metro Manila mayors to implement a 2-week enhanced community quarantine within the National Capital Region. Many small entrepreneurs have not recovered yet from the previous effects of ECQ, a reason why the DTI fears that small and medium enterprises will continue to lose profit.
About lockdown po, kaya may kayanan ulit ito. Nawawala po mga ang estimate ng milyon pesos ng wages for a 2-week nung nangyaring ECQ last March. Siyempre, marami po pati mga negosyo, mga micro SME nagsara.
As of now, the COVID-19 cases recorded in Metro Manila remains manageable, while the authorities are also controlling and implementing a strict monitoring on the Delta variant situation. In the event of implementing restrictions, the DTI pointed out to limit it only for granular lockdowns under LGUs, so that business, trade, and jobs resumes, especially in Metro Manila.
You really have to take a balanced, holistic assessment dito. Ngayon, nakikita natin, effective naman itong minimum power na compliance. At kung saan kailangan, at doon naman nagkakaroon ng granular lockdown. So that keep the economy going and we save jobs and livelihood.
Instead of a wider lockdown, the DTI believes that the focus should be in the prohibition of mass gatherings and super spreader events, accompanied by a swifter vaccination program. The department also reminds business establishments and companies to establish a health and safety committee that will assist and monitor the implementation of proper health and safety protocols. Marvin Calas, UNTV, News and Rescue. We serve the people, we give glory to God.
And for the news abroad, a magnitude 8.2 earthquake struck south of Alaska late Wednesday evening local time, prompting the United States to issue tsunami warnings for the peninsula and other coastal areas before the advisories were rescinded hours later. According to the United States Tsunami Warning System, the earthquake struck 75 miles southeast from the Alaskan city of Chignik and had a depth of 20 miles. The earthquake occurred along the Aleutian Trench, part of Pacific Ring of Fire, with experts predicting that the after effects of the quake may soon be felt in Hawaii, the United States Pacific Territory of Guam, the Northern Mariana Islands. Pfizer and its German partner BioNTech plans to seek authorization for boosters, though U.S. health authorities say that third doses are not needed yet. Marvi Delfin will give us the details live. Marvi?
Riel, as Pfizer requests an amendment to its emergency use authorization, the US FDA and CDC have advised that it is not up to companies alone to decide when an additional dose might be needed. This after findings that the Pfizer vaccine's effectiveness against coronavirus declines slightly over time, but remains strongly protective for at least 6 months after the second dose. U.S. Surgeon General Dr. Vivek Murthy emphasized that people do not need to get a booster shot and that there is much more to the immune system than antibodies. Experts say it remains unclear how antibody levels correlate with real-world immunity and to what extent other parts of the immune system could factor into protection. According to Dr. Michael Dalston, the pharmaceutical company anticipates submitting data on a third dose of its COVID-19 vaccine to the FDA as soon as next month. The new data comes from the study of 44,000 participants around the world that initiated the widespread use of the vaccine, in which protection against symptomatic COVID-19 was 91% over the 6-month period. However, the results have not undergone scientific review and have not been published in a journal. Marielle?
Marvi, with the Delta variant seen as the most transmissible yet, and questions surrounding the efficacy of COVID-19 vaccines currently available, why has the United States health authorities decided to not recommend booster shots?
Marielle, the US CDC says the current vaccines protect people well against all the common variants. Dr. Murthy said that government agencies will still consider the data that will come from companies, and this collective information is what will ultimately drive any decision about boosters. Moreover, Dr. Murthy has also raised the ethical concern for third booster shots, as there is a major vaccine supply shortage in developing countries, which will affect the ability to reduce the likelihood of future variants. Back to you, Marielle.
All right, Marvi, thank you for that live report. The UK governments have lifted quarantine policy amongst fully vaxxed travelers from European countries and United States, but fully vaccinated travelers from Canada still have to undergo self-isolation. Paul Gatchalian tells us why live. Yes, Paul, good evening.
Marielle, fully vaxxed travelers from European countries and United States can now visit their families with ease as the governments of United Kingdom, Scotland, Wales announced they are exempted from quarantine policy effective August 2. English Transport Secretary Grant Shapps said the new measure is to help family members reunite and help businesses that have been hit hard by the pandemic. However, travelers from Canada are not exempted from the new changes. Over 57% of Canadians aged 12 and above have received 2 COVID vaccine doses based on federal government's data, which is similar to the vaccination rate among the same age group in the United States. UK Department of Transport spokesperson issued a statement saying that they are taking a phased approach and are working to extend their approach to vaccinated passengers from important markets and holiday destinations. Meanwhile, Deputy Prime Minister of Canada, Chrystia Freeland, said she has a great deal of respect for every country's sovereign right to decide on that matter. Fully vaxxed passengers from France are also excluded from the no quarantine rule set by the 3 UK governments. These passengers are required to undergo 10-day isolation and a COVID test. If the test is negative, only then can they proceed with their travels. Marielle?
Paul, you mentioned, and I quote, the Department of Transport spokesperson said they are taking a phased approach and are working to extend their approach to vaccinated passengers from important markets and holiday destinations. Does this mean that tourism played a key factor for excluding Canada from the no quarantine policy?
Well, Marielle, there were no clear explanations from the 3 UK governments as to why Canada is exempt from the new rule, given that Canada and US has the same vaccination rate. But to give you some figures though, in 2019, UK has received around 870,000 visitors from Canada. Travelers from the United States, meanwhile, just made a little below 4.5 million visits in the UK, making it the top country for inbound visitors. Marielle?
Thank you, Paul Gatchalian, for that live report. And those are the reasons behind the news in other parts of the globe. I am Mariela Toza, live from Perth, Australia. Good evening.
The Commission on Elections, or COMELEC, remains confident that many voters will troop to their polling places despite fears of the pandemic. This as a survey revealed that almost half of Filipinos would not go out and vote should COVID-19 persist on the day of the 2022 national elections. Harleen Delgado will tell us why.
As COVID-19 cases continue to rise, some senators worry that it would disrupt not only the country's healthcare system and the road to economic recovery, but also the electoral system. In yesterday's session, Senate Majority Leader Juan Miguel Zubiri expressed concern after a Pulse Asia survey which he commissioned revealed that there are Filipinos who might not vote because of the pandemic. The respondents in the survey were asked the question if the number of COVID-19 cases in their place or barangay is high on the election day in May 2022, will they go out and vote or not? The results showed that 35% said yes, 46% said no, while 19% are still undecided. In the National Capital Region, more than half of the respondents will not go out to vote should COVID-19 cases remain high. That is why the senator is calling on the Commission on Elections, or COMELEC, to ensure that health protocols will be strictly observed in polling places.
Mas malaga po naman talaga ang buhay kaysa pagboto. Kaya lang po, nakakatakot dahil posible po na ang mahalal ay hindi man lamang magmula sa boto ng mayorya ng mga botanteng Pilipino. Hindi po yata katanggap-tanggap yan.
He also urged the government to fast-track the vaccination rollout and expand its coverage up to far-flung areas. This as the survey also revealed that 36% of Filipinos are still hesitant to receive COVID-19 jabs. The top reason, they are still skeptic of the vaccine safety and efficacy. However, the survey also showed that they could get convinced if they see that their family members or friends are safe after receiving the vaccine.
When asked on why they will change their decision to get vaccinated, number one answer was kung nabakunahan na po ang kanilang mga kamag-anak at kanilang mga kaibigan at makita po nila safe ang kanilang mga kamag-anak at mahal sa buhay, ay kukuha na po sila ng bakuna.
In a statement, the COMELEC expressed optimism that there would be a sizable voter turnout in the upcoming elections amid pandemic fears. COMELEC spokesperson James Jimenez says this can be seen in some elections abroad that were conducted amid the pandemic and the experience in the Palawan plebiscite last March. He adds voter turnout does not define the validity of electoral exercises. Still, the Commission acknowledges the concern of the lawmaker and vowed that they will ensure the public safety in the upcoming polls. Earlier, the COMELEC said they are expecting at least 80% voter turnout in the 2022 elections out of an estimated 60 million Filipino voters nationwide. Harleen Delgado, UNTV News and Rescue. We serve the people, we give glory to God.
Meanwhile, the government's vaccine experts panel say that administering booster shots for COVID-19 vaccine must not be done in a hurry. Aiko Miguel tells us why.
Booster shots of COVID-19 vaccines add another layer of protection for people who had received their first dose. But the country's Department of Science and Technology Vaccine Expert Panel explains that booster doses should be given 6 to 8 months after the second dose. But the experts say that booster shots are not for the general population. A booster shot is only for individuals who are immunocompromised. When a person is immunocompromised, his immune system's defenses are low, affecting its ability to fight off infections and diseases.
The study indicated that if you will give booster, it should be more than 6 months and not earlier than the 6 months, no? Yung mga HIV, okay, yung mga may cancer, yung mga merong elderly, no, 60 years old and above or more than that, and those who are taking mga immunosuppressive drugs, especially for those who are mga post-transplant, mga chronic kidney diseases, no? So these are the possible population that the VEP will hopefully recommend kung kailangan natin i-booster over the general population.
According to vaccine expert panel, the interval of administering the first and second shots of COVID-19 vaccines, particularly Sinovac and AstraZeneca, should not be shortened. This is because the longer the interval, as indicated in the profile of a vaccine, the higher its efficacy. The Philippine government's vaccine experts panel is also thoroughly studying the effect of the more transmissible COVID-19 variant, on persons who had already been vaccinated. For example, the 5 healthcare workers at the Philippine General Hospital who had received their AstraZeneca vaccine shots but still got infected with the Delta variant. They experienced mild symptoms and were not hospitalized. The vaccine experts panel once again encourages the public to get vaccinated. This is not only to reach the country's target herd immunity, but also to protect citizens from the more transmissible COVID-19 variants.
We need to aim higher and do it faster. So yung dati nating 60, 70, baka 85, 90 na yan. Because of this variant, Delta variant is a real concern. 100%. Lahat.
We do have a variant that is highly transmissible, for example, and your protection will be like 65 or 70%, no? That will not be enough to target just the 70% or 75% herd immunity. You need to vaccinate everyone more than that, no? Because you want to prevent symptomatic infection. Symptomatic ibig sabihin regardless kung what is the severity.
As of today, there are more than 17 million vaccines administered in the Philippines. 11.1 million have received their first dose, while 6.08 million are fully vaccinated. Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
Several Metro Manila cities are imposing granular lockdowns in light of the spike of COVID-19 cases in their area. JP Nunez has this story.
Granular lockdown is now imposed in areas of Parañaque City and Pasay where multiple cases of COVID-19 are detected. In Parañaque City, 2 areas in Canada Street of Barangay San Judicio was placed under lockdown after 4 of its residents contracted COVID-19. This will start today until Monday, August 2. Patients are now brought to isolation facilities and contact tracing and swabbing are intensified. Authorized persons outside of residence or APOR are not also allowed to go out to avoid the possible spread of the more transmissible COVID-19 Delta variant. The local government has already gave them food supplies.
Because of this Delta variant, we are anticipating na yung spread niya mabilis no? So hindi exempted yung kung ikaw ay APOR. For the meantime, hindi ka pwedeng lumabas. Hindi ka ng clearance sa City Hall, bakit hindi ka nakapasok, we will issue because of this calibrated lockdown na ginawa ng city.
Meanwhile, in Pasay City, 14 areas which consist of streets and houses are also placed under granular lockdown. Intensified contact tracing were also conducted. Mayor Emmy Calixto Rubiano explains that patients contracted COVID-19 in Pasay City mostly are non-residents. They mostly lived on apartment and works in private companies in the city.
Ang Pasay naman, although sinasabi nila na wala po kaming surge, ang nasabi nga po namin, let's treat this na parang meron na tayong Delta sa ating lungsod para mas maging maagap tayo, mabilis umaksyon, maging mahigpit at mag-ingat na para ingatan natin ang kalusugan ng mamamayan.
Aside from Pasay and Parañaque, other LGUs in Metro Manila also implements granular lockdown when there are multiple positive COVID-19 patients in one area. JP Nunez, UNTV News and Rescue. We serve the people. We give glory to God.
In other news, the National Bureau of Investigation will conduct a probe into the killing of 2 activists in Albay who allegedly engaged in a shootout with police. Dante Amento tells us why.
Justice Secretary Minardo Guevara has ordered the National Bureau of Investigation to conduct an impartial probe into the deaths of 2 activists last July 26 in Ginubatan, Albay. Through the Department Order No. 175, Guevara directed NBI OIC Director Eric Distor to investigate the killings of Marlon Apiri, 38, and Jemar Palero, 22. 10 days is given for NBI to submit its report. Based on a police report, the activists were allegedly armed and fired on the cops, which prompted the authorities to retaliate and subsequently resulted to their deaths. The police also showed bullet holes on their vehicles. But in a statement, Defend Bicol said the police gunned down the activists who were found spraying a protest slogan against President Duterte on bridge. Meanwhile, PNP Chief General Guillermo Eleazar has also ordered a parallel investigation on the incident through the PNP Internal Affairs Service. It aims to determine what really transpired. Eleazar also directed the Police Regional Office 5 to place the policemen involved into restrictive custody. He urged the public to refrain from speculating and let the investigation to move forward. Eleazar assures impartial investigation over the incident. Dante Amento, UNTV, News and Rescue. We serve the people. We give glory to God.
Meanwhile, did you know that there are people who have extreme fear of medical procedures involving injections? They call this condition as trypanophobia. But with the campaign of the government for the public to get vaccinated, how will these people overcome their fears? Let's find out in Janice and Hench's report.
Jacel Giab has not yet received any COVID-19 vaccine. Working from home as a human resource officer in a private company, Jacel still fears that she might get infected. However, the 26-year-old is still undecided to get vaccinated against COVID-19 as she has fears of needles.
Nawawala na ako ng pakiramdam. Nung nakita ko pala siya na piniprepare, pinagpapawisan na ako ng malamig. Tapos yung heartbeat ko ang lakas na. Although sinabihan ko naman yung doctor na kinakabahan po ako. Sabi niya, ay wag kang kabahan. Tapos sa tono pa lang niya na wag akong kabahan, lalo akong kinabahan.
According to clinical psychologist Dr. Camille Garcia, such condition is called trypanophobia or the extreme fear of needles. This phobia usually occurs to children. However, a person can overcome the condition when he or she gets older. But according to Dr. Garcia, there are also some who do not really lose the phobia of needles or injection.
Maaring nagkaroon sila ng experience na hindi maganda sa needle. So, pwede kaakibat nito yung nung tinusok silang gano'n ng needle, nagdugo. And then, syempre, para sa kanila, anong classic experience to? Yung ang nangyayari, yung extreme na pagkatakot dahil dun sa reaction nila na tinusok sila. Ang trypanophobia kasi, ito isang klase ng phobia na nagkakaroon ng irrational fear or extreme fear sa mga something na sabihin natin invasive na tinutusok sa katawan. So, it can be something like needles o kaya naman yung mga vaccination.
People with trypanophobia may experience dizziness, vomiting, or loss of consciousness when they see the needle. They may also feel hand numbness and palpitation, which can lead to hypertension. To avoid this, Dr. Rontgen Solante, member of a vaccine expert panel, advises to not let a person with trypanophobia to see the needle that will be injected.
There's several ways to do that, no? And depende na yan sa vaccination center. In some centers, you need to really talk to the patient, no, the importance of that. Tapos, hindi mo siya patingnan doon sa needle. Tingnan mo na lang siya sa taas or wherever na hindi niya titingnan yung needle. Kasi yung iba naman, nilalagyan namin ng yung blindfold para lang wala siyang kita.
Although this condition is not considered as a mental disorder, Dr. Garcia emphasized that it is still need to be cured in order not to affect other diseases that a person may have.
Maaring ito, ang kaakibat ito, susunod, hindi na po siya basta phobia, pero pwede kayo magkaroon ng tinatawag na GAD or Generalized Anxiety Disorder, of which is mas mahirap. Kasi every time na lang na merong mga ganyang pagkakataon na ma-expose kayo sa ganyan, 1, pwede kayong himatayin. 2, pwede po yung magkaroon kayo ng panic attack, nervyusin, mamamanhid ang kamay, magkakaroon ng palpitation, o kaya naman masusuka kayo or something may physical manifestation. Yan po yung mahirap kasi maging kaakibat nito ay isa pang medical condition.
Experts advise counting in silence and using your imagination can help you turn your attention to something else when you get vaccinated. Talk with someone to ignore the vaccination or focus on yourself on how to relax your muscles. Doctors again emphasize that vaccinators should also understand such a condition. However, a person with trypanophobia should also understand that vaccination is important to provide self-protection against COVID-19 and other types of illness. Janice Gente, UNTV, News and Rescue. We serve the people, we give glory to God.
before we close, we will leave you with a final word, giving glory to God. From the book of Proverbs, chapter 17, verse 1, it says, "Better is a dry morsel, and quietness therewith, than a house full of sacrifices with strife." And those are the reasons behind the news, July 29, 2021. I am Herlene Delgado.
Reasons we deliver to you as they unfold. I'm Angelo Castro III.
And because we need to know, we will always ask why. I am William Theo. We serve the people. We give glory to God.